It is historic in its arrogance. I mean, it is arrogant to think that we are wise enough, we 100 senators are wise enough in a 2,000-page bill to completely turn upside down and change a comprehensive health care system that affects nearly 300 million Americans, 16 or 17% of our economy, all at once. It is arrogant for us to imagine that the American people aren't wise enough to see through the proposals in this bill, which are to transfer millions more Americans into a Medicaid program for low-income people that none of us would want our families or members a part of. It is arrogant for us then to send a significant bill for much of that to state governments. We make the decision, we send them the bill, and do that in a way that, in my state at least, will cause devastating cuts in higher education or huge tax increases. It is arrogant to say to the American people that it's an $800 billion bill when, as the senator from New Hampshire has pointed out, when it's fully implemented, it's a $2.5 trillion bill, half paid for by Medicare cuts. It is arrogant to say that we have balanced our budget when in fact, we leave outside the budget what it costs to pay doctors to work in the government-run programs that we have today. So, Madam President, this legislation is historic. It's historic in its arrogance. And the American people will see through it and will expect us to instead identify a clear goal. That's the Republican proposal, which is to reduce cost and go step by step in direction toward those goals. Whether we're allowing small businesses to put together their plans so that they can serve more people at a lower cost, whether it's allowing competitions across state lines, whether it's reducing junk lawsuits against doctors, whether we've made all of these proposals. We're ready not to roll a wheelbarrow of our own in here with the comprehensive proposal, but day after day we've said, instead of increasing costs, raising taxes, allowing premiums to go up, and shifting costs to states, and dumping low-income Americans into Medicaid, let's reduce costs, and we have a plan to do that.